My name is Paul Gorn. I'm a social worker by profession.
My name is Rebecca Kemp. I'm a specialist speech and language therapist within Ridgeway.
I'm Simon and I'm a forensic psychologist here at Ridgeway.
Hi, my name's Melanie and I'm an occupational therapist that works within Ridgeway.
Hi, my name's Jan McAdam.
I suppose we're the glue or the link to the community. We provide that linkage for patients to family, to friends, to professionals, to other agencies, and we're also integral to discharge planning.
Speech and language therapy in its broadest term provides evidence-based assessment, intervention and support for adults who have difficulties with communication and or eating, drinking and swallowing, also known as dysphagia.
Psychology is all about how we feel and the way we think and why we do the things that we do. And psychology as a department can be helpful to speak to if the people that we support here or the patients notice that there's any difficulties that they have in any of those areas and want to make some changes.
The occupational therapy team within Ridgeway is made up of occupational therapists and occupational therapy assistants who often support patient interventions. The purpose of occupational therapy is to identify and reduce barriers and challenges that might impact a person's ability to complete activities that are essential and meaningful to them.
As a consultant nurse approved clinician, I'm the responsible clinician for the ward in which I work. That's working in the same capacity remit as my medical forensic consultant psychiatrist, but my role is a consultant nurse.
In terms of speech and language therapy within Ridgeway, and in line with the Trust's journey to change, the ethos of the speech and language therapy team is to empower, enable and support patients to advocate for themselves and be involved in their own care and recovery journey. The speech and language therapy team offer a holistic, client-centred and co-created approach to interactions, including therapeutic interventions with other members of the multidisciplinary team.
We're usually at the forefront of liaising with somebody's home authority to make sure that when they do move on, their needs are being met and they've got the right care package and support around them when they do move on from us.
Working as a consultant nurse, by default you work towards 4 nationally recognised pillars. The additional remit is the approved clinician. As I mentioned, that's working as a responsible clinician and being responsible for the patient, for the service users in that clinical area in application of legal frameworks such as the Mental Health Act, Capacity Act, etc.
Everybody who comes to the hospital here at Ridgeway gets the opportunity to meet with a psychological professional, and that's to help identify their personal goals and the things that are important to them that they want to work towards in terms of moving on from here. We think about discharge on the very day that people are admitted to get back to the lives they want to do.
We work with patients by setting meaningful and purposeful goals. Things that we might support patients to do is find new interests, get back to doing those that were important and meaningful to them before coming into hospital. We might support patients to develop daily living skills in the areas of self-care, productivity and leisure.
The speech and language therapy team work closely with other professionals to provide support and advice and encourage environmental changes to promote inclusive, accessible communication and dysphagia advice. Throughout our work, co-creation with the patient is a key factor. By involving the patient in the planning of assessment and intervention sessions, it ensures that the focus is on the patient's specific want or need.
Collaborative working, as I say, in a tripartite approach is really important to be able to have that richer formulation and yield better outcomes for all concerned, because the formulation is going to be much richer with professionals, service user, families and carers.
What the psychological professional will do when meeting with a patient newly admitted to Ridgeway is to focus on co-creating an intervention journey. So that might be learning the skills or coping strategies that they need in order to get to where they want to be or closer to their personal goals. We might need to link in with professionals from other specialist teams such as speech and language or occupational therapy or the community team to make sure that everyone's getting the right help for what they want at the right time.
Our dynamic and flexible approaches can be based both on and off the ward, in one-to-one sessions or in a group setting where support from their peers can be offered to the patients. Within the multidisciplinary team, speech and language therapy work with other professionals and the patients themselves to create collaborative goals that maximise intervention gains for the patients in an accessible format.
We also support patients with routine building, money management, things like budgeting, communication and interaction skills, and also community skills in connecting with the local community. So this might be things like volunteering, going to sort of community groups, or those sort of general shopping and daily living skills. We might also support patients with equipment provision to promote that independence, or adapting their current environment so they can engage in things that are most important to them.
Any new admission onto the ward, it's imperative that we get the family carer views. We may have consent, we may not, and as there is ways around that without breaching confidentiality for the service user.
We encourage and welcome family and carers to get in contact with the psychology department if they have questions. They might want to know what it is that we do and how we do it, so we can explain about the sorts of specialist assessments that we're trained in that help us better understand somebody's needs, and also the range of interventions and therapies that we deliver either in groups or one-to-one to try and help patients move forward and meet their goals.
Any family members, carers can contact the ward. They can have opportunity to speak to the named nurse, the consultant, or different other members of the MDT team. We welcome that.
In terms of progress for the patients, it makes me feel amazing when they do progress, but I don't pretend that it's just anything that I've done, it's the patient wanting to improve and acquire skills and their own motivation, so it's definitely a joint effort all of the time.
When I can see somebody through from the beginning, when things might not be so good, to the end when they're moving on and getting their lives back.
My favourite thing about working in Ridgeway is I think we're recovery focused. Everybody is here to promote recovery for service users.
I've been working in Ridgeway for 11 years, and there's a lot that I find really rewarding about my work here, and it's seeing those changes from the day somebody comes into our service and the help that they might need or want at that point, and being able to see them change and evolve and embed those and go back to a life in the community with their family and carers.